Hello everyone, I am Ms. Soumya R, Assistant Professor from the Department of Psychology from Dr. S.N.S. Rajakshmi College of Arts and Science. Today's video is about a case study on depression and stuttering. A 13-year-old boy was referred for speech therapy but was diagnosed with major depressive disorder. The case study was about a 13-year-old boy and was referred to speech therapy because of his stuttering. He started to stutter when he was 3 years old, and that time he also had bedwetting problems. In the early period during his diagnostic process, it turned out he had serious emotional problems. He was often moody and sad without any reason. Sometimes he became irritable and withdrew from the social situations. At the time, he lost his interest in school and was thinking about committing suicide. Different method was used during his examination. First interview, second mother's report, third one was drawings, and other was Rorschach test was implanted and explored his intention of suicide. On the first interview, the grandparents called because of their grandson's stuttering. The mother and her son come to the first appointment. The boy is tall and thin, moody, not happy. He seems older than his age. He speaks very low. The mother appeared to be almost 30 years old. She was an average woman, long brown hair, big brown eyes, smiling face. She says that the teacher complains about her son who has behavioral problems in school. He is not able to control his strong emotions. He is often angry because his classmates tease him. She adds that he is often moody and sad. She feels that he has affinity to depression. She tells an incident when stranger boys attacked her son while he was walking in the street on his way to the video shop. They teased him, got around him, and when he tried to run away, escape, they tripped him up. He stumbled and hurt his eyes. He did not know those guys in person, just somebody by sight. This case shocked him very much, and since then he has become more introverted and started to think about committing suicide. He told it first to his teacher in the school, who called his parents, but they did not attach great importance to this and did not ask for help. Kid thinks that the source of his problem that when his classmates made him angry, he cannot control his emotions. The teacher notices when he starts to hit them, she punishes him. Mother's report. From the history, the following details are important. The mother was comparatively young when she became pregnant. She was 21 years old. The pregnancy and the birth were normal. Kid was breastfed for 6 months, was walking at 9 months, and was toilet trained by 3 years. It was interesting that mother did not remember his speech development. He did not fit in the nursery school, but later he managed to adapt to it. He was lonely in the school and did not have any friends. He began to stutter at 3 years old and he had bedwetting problems when he was 4 years old. He has got two brothers, one is 12 years old and the other is 7 years old. When his brother was born, he was only 1 year old and the birth of the eldest was a shock for him. When first brother was born, his mother went unexpectedly to the hospital. His father was very busy with his work and left the child in the care of grandparents in their house, so the grandparents took care of him. Grandmother did not allow him to be taken to the hospital because it would disturb him. He changed very much when they took him finally and rejected his mother. It was traumatic experience for him because he was to be young to be separated from his mother for a longer period. Conclusion of the diagnostic process: the kid was separated from his mother when his younger brother was born. The next separation from his mother was very difficult for him. He did not fit in the nursery school. He was 3 years old when he began to stutter and 4 when he had bedwetting problems. The symptoms are signals of his anxiety. His stuttering could be seen as reaction to his early separation. Fitting in into the community always goes slowly for him. He also has integration difficulties. He was lonely when his classmates tease and exclude him, which makes him angry. Not long ago, his mother changed workplace and spends less time at home. Not much later, he started being concerned about his depression symptoms and suicidal thoughts. During the diagnostic process, it was realized that his problems are deeper than speech therapy that could help with. So depression is actually a main problem of the kid. Every child has an emotional ups and downs, but for some children, feeling blue for more than a week can be sign of depression. Depression in children is a mood disorder that leads to feelings of sadness, that interfere with their relationship and activities. Talk therapy and cognitive behavioral therapy and medications are the main ways to treat the depression in children. Depression in children is a mood disorder that causes them to feel sad, irritable, and hopeless. Children often have mood swings. They may feel sad or irritable for a period of time, like after getting a bad grade or falling out with friends. But after a while, they tend to feel better again. Depression is different. If your child has depression, their sadness hangs on for more than 2 weeks. They may also have irritability or hopelessness that lingers. It may affect your child's sleep, appetite, and relationship with others. Depressions can also prevent your children from enjoying school sports or hobbies they once enjoyed. In several cases, depression can lead to thoughts of suicide. If you notice that your child has symptoms of depression for 2 weeks or more, talk to their healthcare provider. Types of depressions in children. First one is a major depressive disorder. From other people call this clinical depression. It's most well-known type of depression in children. Second is a premenstrual dysphoric disorder. Third one is a seasonal affective disorder. Fourth one is a disruptive mood dysregulation disorder. Fifth one is a dysthymia. How common is depression in children and teens? It was about 3% of children and teens between the age of 3 and 17 have depression. It is common in teens than children. About 1 in 5 teens have diagnosed with a major depression. Yes, in our case also, the child is suffering from the major depressive disorder. So the from the diagnosis, it is referred that psychotherapy is better treatment, and first the psychotherapy would be given rather than the speech therapy. Thanking you. The references are made for the further clarifications. Thank you so much.